I don't have to convince myself or teach myself how to behave at a wedding versus a funeral. To me and to you, it's kind of common sense. I know which trait I need to pull out and how to behave that's appropriate so that I don't cause any trouble in those settings, right?
It's like they know one song. Say they know Jaws, the theme song to Jaws.
Yes.
And they know that it's really good at a horror flick to play that theme song, makes people scared. But they pull it out at the wedding, or they pull it out at a funeral, keep playing that one song in every situation. Are narcissists made or born? That's the question Dr. Peter Salerno is going to address in this episode. He's a psychotherapist who recently authored the book, The Nature and Nurture of Narcissism. Today, I'm so excited. I'm joined by Dr. Peter Salerno. He's a psychotherapist practicing in California, right, Peter? I came across him on Instagram and was really blown away by his understanding of the narcissist and the narcissistic mind as well as personality. So at first, how did you get interested in this, Dr. Salerno? What drew you to this type of personality or type of person?
Well, I guess like most people, probably personal experience, but also professionally, I have all my degree programs, my master's degree, my doctoral degree. There's not much emphasis on personality science, personality pathology. So we're trained and licensed once we get licensed to treat them and diagnose them. But what I noticed is there's just a lot of theory biases and things that just kind of get in the way of really understanding what's going on in the narcissist and in personality disordered individuals. And so these treatment interventions or these like symptom-oriented psychotherapies just don't seem to be working on a particular group of people, but we keep attributing it to the same thing. You know, these individuals must be traumatized. They must have an inferiority complex. I investigated that because the interventions weren't working. And in my personal life, I was trying to apply what I knew to try to get out of a dangerous situation. And it was just making things worse. And what I noticed is that's what happens in therapy too, with victims of these individuals. So I was kind of on a quest to figure out, is there anything else that's not common knowledge, right? That's not widely accepted, but makes more sense. And so I just started reaching out to and studying under, through continued education, like the experts in personality pathology who seem to be getting it right, not according to popular media, but that's really what kind of jump-started this interest in that. And I would say that in hindsight now, a lot of the dynamics of even my family spanning back generations probably had a lot to do with some of this personality pathology as well. And it's really important to know what you're dealing with and to make sense of it. So combination of professional and personal experience.
What was one of the first myths that you blew apart for yourself, that you realized you'd been getting wrong?
Individuals who are like meet the criteria for pathological narcissism or a narcissistic personality disorder, that they are behaving the way they do because there was some stunting in early development that interfered with their ability to attach, or there was an empathic failure or an overindulgence or some sort of a chaotic, traumatic, neglectful environment that was the cause of why they are doing what they're doing. That's the first myth. Just doesn't hold up in clinical practice. It doesn't hold up in research outside the fields of, like, we'll say, like the psychodynamic, psychoanalytic sort of humanistic backgrounds, those modalities. It's just not consistent as far as what research is saying now from behavioral genetics, molecular genetics, neuroscience, neurobiology. I mean, there's a division in the research, and there's people who are on, one side or the other, and some who are kind of in between. But that was the main one, is that these ideas that trauma causes narcissism, this has been discredited decades ago, and most people aren't aware of that.
I often say to people, I got to hear Dr. Vander Kolk speak at a Washington, D.C. at a workshop. So I got to hear him personally say this. And he said that in the United States, roughly 80% of the populations experience what he called the Class A trauma, which I'm not for sure exactly how he categorizes what a Class A, but to me, it sounds pretty significant. Then he goes on and talks about trauma recovery. But if you just use that statistic for a moment, 80%, and if we think based on the best statistics from government right now, which says 7%, which I still think that's too low, but let's just use 7% of the population is narcissistic. That doesn't correlate. I mean, if 80% of the public has been traumatized and only 7% of the public ends up being a narcissist, then how could you say trauma causes narcissism? You can just see it just doesn't, it's not a strong correlation. Definitely not causal, because then it would be 80% of the population would be narcissistic. but it's not even a strong correlation. It feels random almost to me. You've mentioned there's two camps. What are the two camps of beliefs about how narcissistic personality disorder gets formed?
Well, I guess the two mainstream popular camps are trauma, neglect, abuse, chaotic upbringing, or overindulgence, overvaluation. And then where both of these fall short is, like you just said, only some are narcissistic in those environments. And so we have to look at, etiology, cause versus risk factor, and even, correlation. But if this environment isn't consistently producing the same, thing or even similar, then we have to kind of go back to the drawing board and figure out, well, what are we missing here? So the less widely accepted camp that is starting to, rear its head and the facts are just kind of discrediting what most people either they don't want to believe this is true or they don't really quite understand what it means, is that we're kind of starting to understand that we've been wrong or over or almost 100 years. Mental health science has been just wrong when it comes to classifying personality disorders. The adult problems we see in narcissists are not the direct result of something breaking down in childhood. That if somebody is a narcissist as an adult, when we talk about narcissism, we're talking about pathological narcissism, not this cultural narcissism or we're all kind of narcissistic to a degree and we outgrow it. Not that type. The diagnostic form of narcissism, which is the one that's the problematic one, is highly heritable. That's what we are learning and have learned based on controlled studies, right? Objective studies, not studies based on self-reports of patients or interpretations from therapists where they have a specific lens of how they conceptualize a patient and how they conceptualize psychology in general. These are now controlled studies that are producing the same results and that can be replicated, and then longitudinal studies that can, examine two different points of time are showing this has a lot to do with genetics. This has to do with heritability, just like physical traits are heritable. And so moving into that realm, then we have to look at neurobiology, we have to look at neuroscience, we have to look at the way these brains are operating, like the operating system. We have to look at how it's different than what we typically refer to as like a normal or neurotypical brain.
Right. In fact, there's a fascinating article in Nature where they actually have images of the brain and compare it to a typical brain to a narcissistic brain, and they do look different. It's obvious the kind of discrepancy between the two. But why do you think this matters? The inheritability of it, why does that matter?
Because we have to know how to treat it, because as you know, treatments have historically failed with these patients. I mean, personality disordered individuals in general, not just narcissists, but even the ones that share the same cluster. So the antisocial, the histrionic, the borderline, they don't respond to treatment, symptom-oriented psychotherapy treatment, and they don't respond to trauma treatment in the way that other people do. So right there, we're also wondering, well, if it is all related to trauma, why are only some people who are not narcissistic responding to the trauma interventions, and the ones who are narcissistic either are getting worse or there's just not an impact whatsoever? And so if we don't know what the cause of the dysfunction is, then we cannot sufficiently treat it. And so one of the things that most people complain about is these people don't change, they don't want to change, they know what they're up to and they refuse to change. So if that's true, maybe it's one of the reasons that they're not changing in treatment is because we're using the wrong tools. And so we need to look at what might actually work with these individuals, because these trauma-oriented interventions and symptom-oriented interventions just are not getting the job done.
I also think it's really important because victims get told that trauma, first of all, that elicits a lot of sympathy.
Yes.
You hear somebody's had a bad childhood or maybe things have gone wrong with their parent, that you end up thinking, okay, we can overcome this. And also there's then reasons for me to have a lot of compassion because then it's not their fault. We see that as sort of an excuse or an explanation. But knowing this for me, I know if I had really understood that more deeply at the time and I was in a narcissistically abusive relationship, it would have helped me been able to say, I'm not going to save this person. It's okay to leave.
Yeah. Because you hold on to this kind of what I call like a fear-based hope that if it is trauma, something's going to eventually get through. We can convert this person into a nicer human being with the right treatment. But the problem is the treatment fails with victims because of what you just said, because they're being told by the professional they hired that your partner just needs to do a little bit of therapy. Maybe they do the really dangerous thing where they ask their patient to invite their partner, their pathological partner, into therapy, which is a huge no, like it's not good. But basically that's one of the main treatment failures is that the therapist is telling the victim, you are dealing with a trauma victim at home, and that trauma victim just needs that wounds healed, and then your relationship can get better. Well, the research is showing that because a lot of this personality pathology is hardwired, you can't give people this false hope that they're going to change. It's just causing a lot more harm.
So let's get into what is the truth about a narcissist. What is their mindset? To the degree that you and I can try to imagine, how would they see and experience the world? What is their point? What is their goal?
Yeah. So narcissists, in the way that I understand the research and the research that I typically share and promote, is we have to start looking at these disorders as trait deficiency and trait excess disorders. So we all have a psychological toolkit that we call a personality, and we can pull them out, these different aspects of our personality, these different traits which make up our character. And we typically, if we are reasonably within the spectrum of what we call normal in the sense of culturally, socially, morally acceptable, we have a distinct number of traits. So I don't have to convince myself or teach myself how to behave at a wedding versus a funeral. To me and to you, it's kind of common sense. I know which trait I need to pull out and how to behave that's appropriate so that I don't cause any trouble in those settings, right? Even being interviewed here, there's a certain adaptability that's required and just, having a dialogue here.
I once heard Dr. Gregory Lester say, it's like they know one song. Say they know Jaws, the theme song to Jaws.
Yes.
And they know that it's really good at a horror flick to play that theme song, makes people scared. But they pull it out at the wedding, or they'll pull it out at a funeral, keep playing that one song in every situation.
Right. And so going off of Dr. Lester's research, who that guy is, he's incredible. He's worked for the Department of Justice. He's the personality disorder guy. His office was the site of the DSM-5 for personality disorders. He knows what he's talking about. So that one trait, that predominant trait for narcissists, for example, is grandiosity. What that causes them to be deficient in is the idea of equality. They don't believe or perceive inequality. So from their fixed trait of grandiosity, which is it's an unearned, undeserved sense of self-importance that can't actually be backed up by anything. It's just the expectation is that they are better. It prevents them from being able to see other people as equal to them. This has been shown to start to develop and actually be seen in preschool-aged children, regardless of upbringing, regardless of environment, regardless of adoption, regardless of biological parents, whatever your environment is, this is a trait that is not being caused by an environmental factor, right? It could absolutely be amplified by certain environments, but that would be a risk factor, not a cause.
Yeah, I came across an example with my ex. He had his identity stolen, and the person who had stolen his identity, and I actually had proof, so I know it was real. And I found the individual, by the way, I found the individual on Facebook who's using his name and his social security number, and this individual had gone on and earned an MBA.
Oh.
My ex had a college degree, but he confessed to me that he had paid people to write his paper and that it was a non-accredited program. So really, it wasn't worth a lot. He said, since that person who's using his name and social security number has this MBA, he should contact the school for another copy of the diploma as well as for the transcript because it's in his name. So technically, wasn't it his? And I'm thinking, you can't pull it off. How would you pull off that you have an MBA just because it's in your name? But in his mind, that kind of ties into this grandiosity. He really believed that it was his because his name was on it. That he'd earned it just because of who he is in the world, he thinks. Whereas the rest of us would say, well, you need to show knowledge base. You need to show education. Can you back it up with work experience? We would say there's all these markers of credibility and you don't have them. But in his mind, he did because he believed he did.
Yeah.
It's just wild.
So this brings up a really important point too, is they really do believe these things. There's this other myth that has already been discredited, but is pervasive in culture. If someone's acting this way, it's because they are compensating from some inferiority, some deep-seated fear, low self-esteem, self-loathing. These people go home and they hate themselves. And everything we see of them is this mask that's artificial and is really just a front to conceal this deep-seated inferiority. When narcissists believe something, they believe it 100%. So if they believe that they earn a diploma they didn't earn, and they portray it as if they did earn it, that's not a facade. They truly do believe that they are entitled to that. It has nothing to do with low self-esteem, low self-worth. That is one of the biggest misconceptions and one of the most dangerous ones, because that is what keeps perpetuating this idea that we can just find the wound here and heal it. And so then they're going to stop being narcissistic. And we have to start realizing these traits are, for the most part, hardwired. Now, some people, including Dr. Lester, whom you mentioned, said he can work with these individuals and get them to no longer meet the criteria for narcissism. That would require the narcissist to be collaborative enough in treatment to stick with it. And it would require a clinician who knows exactly how to talk to these types of individuals, because you don't talk to them the way you'd talk to a trauma survivor or victim.
Right.
They don't respond to that.
So to follow up on that, do you then disagree with the fact that there is a core of shame at the root of them? Because I know that George Simon says he sees it more as a lack of conscience versus the core of shame. What's your thoughts on that?
I'm more on board with Dr. Simon. I'm a huge fan of his work. I've attended his seminars and Dr. Lester's seminars. I don't believe narcissists are suffering from this deep shame. And it depends on how you define shame too. But I think people need to understand that there's a difference between even the emptiness that is experienced by a cluster B personality, like a narcissist. It comes from these trait deficiencies. It doesn't come from an experience that has wounded them to the core and they feel bad. They don't feel bad about themselves. When they feel bad for themselves, which is a huge distinction. One is feel sorry for me. The other is I'm so displeased or disgusted with myself. They don't go there. They have an emptiness in them for sure, but it's because they are lacking these traits that most of us take for granted, which would be the ability to collaborate, cooperate, be agreeable enough, be sensitive enough. Because they don't have that, there is an emptiness that they experience, but it's coming from a deficiency that's not related to not being loved or some empathic failure. That's not why they feel the way they do. So I don't agree that they are experiencing shame.
Yeah, because that example, if I had tried to promote myself in some way that I knew was false, and I knew that it wasn't true, but I wanted to just take it on and attribute it to myself, I would feel shame for myself for doing it. I would feel embarrassed. If my partner questioned me on it, I would feel really embarrassed. I know on my face it flushed. I would regret that I even had that thought and want to go hide. But what I've watched with him was there was no awareness that that was a problem. He was truly mystified about why I saw it as an issue. And he believed that he deserved that just because of him being in the world. In the times I caught him feeling shame, it was for being called out or being uncomfortable in a moment, but it wasn't like it created some crisis, some psychological despair for him. It was more of, oh, shoot, you saw that. I don't like that you saw that. And then we'd move on.
Yeah. And I would actually say that's more of a humiliation than a shame because it has to do with impression and image management. And sometimes when they get caught where they can't be in full control of managing the image and the impression, they get humiliated. It doesn't always look like they get enraged. It can look like something else. They can respond to it in a more covert way. But I'd say it seems to be with narcissists in particular, they get humiliated when somebody potentially sees a flaw in their character, but that's not the same thing as shame.
Yeah, because shame's an internal experience.
Yeah, I mean, shame comes down to like a belief almost about with a moral, emotional component to it that like I am bad at my core. You can't find a narcissist who believes that about themselves. I mean, no, they'll say it. They know the language, they'll say things like that and try to sell it to you. They do it to therapists too. A lot of their complaints in therapy are very vague. It's sort of like you can't really pinpoint like a symptom or an experience. It's more like they come in and they'll say, people don't understand me. I have low self-esteem. And then they just kind of throw out these random things that aren't very, superficially, they're saying important words, but there's no emotional depth to them. It's almost like, did you just hear this before you walked in? Because it doesn't really add up to the presentation,
Well, there's no psychological distress.
No.
They will say things that if I was to say them, I would be in tears. It would be difficult to say out loud, internal conflict with what I'm describing. I've seen a lot of narcissists in my practice back in the day when I had my private practice.
Yeah.
And I experienced that too, sort of this shallowness, this detachment from what should be a psychologically distressing experience. And they're not that distressed.
Yeah.
It made it very difficult to work with them because that's what you need in the office to have an effective outcome. And that's what I even noticed in that relationship. I know I talked about this with Dr. Les Carter recently, was I likened it to playing hokey pokey. I felt like I got my ex's arm and maybe a leg, but he never put his whole self into the ring. So there's this detachment. That's what I experienced, this psychological detachment with the world, which do you think that's the core, that emptiness? And we use that word a lot, but I don't think people know what we mean when we
No,
say that. To me, what I saw was this lost, restless angst that just kept driving him for more.
There's a difference between like emptiness and, or we'll say, I guess, the kind of emptiness that a narcissist experiences and the emptiness that you would attribute to somebody who has just suffered a profound loss or is grieving or is depressed even, has major depression, or somebody who has like deep, low self-worth where they just really do hate themselves. That's not the kind of emptiness we're talking about here. The emptiness we're talking about here is there is an inability to attach. And so there is a disconnect in them that doesn't allow for the type of relating that most of us would take for granted because of those missing pieces, those missing traits. They don't have it in their toolkit, their psychological toolkit, to feel the way or feel about, relationships the way that other people do. So I would say that we don't want to see the emptiness as, I feel so sorry for them because they're in such despair. It's more of an emptiness is like, there's much less there than meets the eye. And it's because they don't have all the traits that we have decided collectively make us human, right? Maybe this is going off on a tangent, but I wouldn't say that the emptiness is something to feel sorry for. It's almost just like there's so much less substance there. And that can cause them distress sometimes. It can also cause them to feel fragile because all they have is this image. There's not really a real self behind it.
I liken it to the buildup we have with Christmas. And we can over-romanticize, idealize. It's going to be this incredible experience. We can even fantasize about what that Christmas meal is going to be and having family in the room and how are people going to react when they open the gifts. It's going to look like a Hallmark card movie. Mm-hmm. And then we experience and it doesn't match. And we have this big letdown between the discrepancy of what actually happened and what we hope to happen. To me, I think narcissists walk through their world living life like that life is constantly like that. My ex used to say he had an addiction to fantasy. I think he's right. That he had in his head an imagination, what he thought it was going to be. Fell in love with that. Problem is life, and people are people.
Right.
They're not a Hallmark movie, but he kept expecting that,
yes.
I think.
There's a lot of fantasy in their day-to-day. However, that is not the same thing as lacking reality testing. They're not psychotic or delusional. In that sense, they are sane.
Yeah.
But that fantasy and that idealization that they chase is what causes the disappointment in their life. Things that aren't consistent with their worldview, they fall off the pedestal. This is one of the things that is one of the major contributing factors to like the discarding of people, is because you were supposed to be a certain way for me and you're not. And so now I can't tolerate that. I got to go find what is. Problem is, just like Narcissus looking at himself in the pool of water, he's going to starve to death because that's the only thing that he feels is sufficient. So if you don't find that out in the world, if you don't find your own reflection, your own idealized reflection in the world, you're going to mistreat people. You're going to be disappointed. And so they don't know that that's why they're having problems. But this is one of those things. And I think that's a very good example is if things fall short for them, if the buildup is there and then the delivery falls short, which it inevitably will because nothing's perfect, they can't tolerate that. But they also present themselves as being, the pathway to Christmas. Like everything's going to be great if you just hang out with them. It's going to feel like Christmas Eve every day, which isn't true.
Yeah, I always say they lie first to themselves and then everybody else.
Yeah.
But yeah, you're right. And that disappointment that happens with us could be something subtle. Like maybe you used the wrong fork at dinner, and in their mind, you should have known better to not do that.
Yep.
And then suddenly the caricature of you, the fantasized, idealized caricature of you is destroyed. And then they're done. And they're going to start to look for somebody new and do this all over again. So I'd love to jump over to the podcast extra and talk to you about the callousness in which they use relationships and just kind of dissect that better with you. But I could already tell I could talk to you for hours. This has been so much fun. Thank you so much for being on this podcast today. It was just a delight.
Thank you for having me.
Where can people find you? Let's before we hop off, where can they find you?
Yeah. So I have a website, drpetersalerno.com. I'm on Instagram, Dr. Peter Salerno. I have a YouTube channel, same name. I just released a book called The Nature and Nurture of Narcissism, which is just kind of covers all of the research that we're kind of discussing here. This kind of new perspective on things, which can be found on Amazon and Audible and all those places.
Well, you're a welcomed voice. So when I came across you, I thought, oh, finally, someone's saying some things that need to be said. So
I
thank you
appreciate
for
that.
doing that.
Thank you.
Well, that's a wrap for this week's episode. Are you following me on TikTok, Facebook, Instagram, and YouTube? Find me at Kerry McAvoy, Ph.D. And whether you're in, consider leaving, or have left a narcissistic relationship, find community support at my Toxic-Free Relationship Club. You can learn about this resource as well as others at kerrymcavoyphd.com. Now you don't need to wait a week to get your next podcast fix. Join Breaking Free from Narc Abuse at substack.com to get exclusive audio content for subscribers. To sign up, click the link in the show notes. And I'll see you back here next week.